we are going to discuss about glaucoma. What is glaucoma? Glaucoma is a condition in which there is elevated IOP, optic disc-cupping, visual field defect, and the damage of optic nerve. Progressive damage of optic nerve is seen in glaucoma. So it is characterized by optic disc cupping. There is visual field defect and elevated IOP. Intraocular pressure is raised. That causes glaucoma. In glaucoma, what happens that there is damage to optic nerve irreversibly. Now, normal intraocular pressure is 10 to 21, but when that intraocular pressure is greater than 21, it causes glaucoma. When intraocular pressure is elevated or becomes more than 21 millimeter of mercury, causes glaucoma. Now coming to the normal anatomy of eye or the flow, we will be discussing the drainage of aqueous humor. Now this is the cornea, this is sclera, and this is optic nerve. So coming to let me to draw the big picture of cornea. This is cornea, this is sclera, and this is optic nerve. Now here lens is located. There is a space between lens and a cornea divided into two chambers. One is anterior chamber, another is posterior chamber. This is the iris. Here is the aperture. Iris is not a structure, it is only aperture or the pathway for flow of aqueous humor. Now aqueous humor is produced from ciliary body here in posterior chamber, and from posterior chamber it is drained into anterior chamber. Aqueous humor from posterior chamber drained into anterior chamber, and in anterior chamber it goes into trabecular meshwork. Trabecular meshwork located here in the small picture we can see trabecular meshwork. So from posterior chamber into anterior chamber through iris, and from anterior chamber goes into trabecular meshwork, and from trabecular meshwork it drains into episcleral vein, and from episcleral vein into subophthalmic vein, and then it is aqueous humor is drained into cavernous sinus. This is the normal pathway of aqueous humor, means from posterior chamber to anterior chamber, from anterior chamber to trabecular meshwork, and then trabecular meshwork to canal of Schelem canal, and then aqueous humor drained into through subophthalmic vein, and finally into cavernous sinus. This is normal flow of aqueous humor. And in glaucoma, what happens that whether the increased production of aqueous humor or decreased flow of aqueous humor, obstruction in flow of aqueous humor causes glaucoma. That is a basic mechanism behind the pathophysiology of the glaucoma. Now coming to the classification of the glaucoma, there are different types of glaucoma. One is congenital classification, and another is developmental glaucoma on the basis of age of the patient, and on the basis of other types there is primary glaucoma and secondary glaucoma. Now on the basis of age there is congenital glaucoma and developmental glaucoma, and the another classification is primary glaucoma and secondary glaucoma. Primary and secondary glaucoma is also divided into primary open angle glaucoma and primary closed angle glaucoma. Secondary is also divided into secondary open and secondary closed angle glaucoma. We shall be discussing each of these every topic in the next portion of the lecture. Now coming to the brief introduction behind the primary and secondary glaucoma, that in primary glaucoma what happens, primary congenital glaucoma, it is as word indicates, this congenital means the glaucoma present at the time of the birth. Pathogenesis behind the primary congenital glaucoma is male development